Good evening, Malaysia and followers from around the world. Our COVID-19 cases, they have kept spiraling up, and that every other day is a new record for Malaysia. Malaysians are asking, are we doing the right things? Or is it time for new approaches, new strategies? What should and what can be done? Because as far as the riot are concerned, we have done our part. We have kept ourselves locked up, but the lockdown has not produced any results. After 1.5 years, we have failed. That's the word, we have failed. And I think we should be honest about it, be brutally honest about it, that we have not solved the problem. It has gone worse. We have been told that the increase in numbers is the result of mass testing. And I'm sure there are millions and millions of factory workers which has not been tested. And if we have to keep on mass testing, that means the numbers will not go down. It's that simple. And the question is, can we even meet our vaccination program of having herd immunity by next 2-3 months? Okay, now, we're here tonight is Tan Sri Dr. Muhammad Ismail Merican. He was the Director General of Health. He was the President of the Malaysian Medical Council. He is a specialist in, I'm going to read this slowly to get it right, gastroenterology and hepatology. I hope I'm right, Tan Sri. In short, he specializes in treating stomach, liver, and digestive system. And there are not many of them around in town, okay, in Malaysia. He's a real specialist. And of course, my comrade, Tan Sri Johan Jaafar. Welcome. I have two Tan Sris of me. Thank you for joining. Doctor, we will just go straight to the point, okay? Yes. Now, we are at a very critical stage of the country. The economy is near collapsing. Hospitals are collapsing. And that even the top health officials tells me that, look, the hospitals are now like a war zone. And we have seen all these pictures and videos that has gone viral. Tell me, Doctor, what should be done now? Do you agree that what we have been doing so far after 1.5 years have not produced anything that is reasonable to help us to move on?
Okay, thank you very much, Datuk Sri. I've tried to refrain myself from commenting because, as I've told many people, the train has left the station. But somebody mentioned that the train has left without a driver. Now, you cannot keep quiet anymore because of the staggering number of cases, the crumbling of our healthcare system, and the plight of our exhausted healthcare staff. Now, death and infections are escalating very, very fast. And if you do not shift gears in the next 2 months, you're going to see the same kind of scenario. There was somebody who commented that cases will go down in the next couple of weeks. I don't know, I won't mention who said that, but of course it is not correct. Now it is even worse than before. So almost a third of the country are on the verge of despair, sacrifices, have difficult choices to feed families and all the rest of it. And the social net of the country is not robust enough to take care of those who have lost their jobs. Now, the present strategy may have worked before. I mean, during the earlier lockdown, where it was a real lockdown, but it has not worked now. I mean, you go to the roadside and I traveled to Prince Court and I see many cars on the road. What lockdown are we talking about? So people are not just adhering to the SOPs, and the mental health, the economy, and the plight of those who have lost jobs should be taken into consideration. Not just firefighting from ministers who smile and think they're doing a great job. Now, sorry to say, the present government is not listening to us. There have been a lot of viewpoints expressed in the mass media and the social media, but I don't think people are listening. And there is a trust deficit within the country and internationally. And lockdowns have not achieved the desired effects. It may be useful before, but not now. Now, what are the things that I can offer you? What are the things that we can do differently? We have to do things differently. We cannot do same old tired measures. Yeah. Now, the first thing I think we need to do is a better coordination and collaboration with the different players. You may say that it's happening now, but it is not. There's not much collaboration and there's so much coordination. Different people are talking different languages. Secondly, there should be a single spokesman on technical matters. You know, there are too many confusing and unclear messages. I will expand on this later. Thirdly, pooling of resources. That means you must get the private hospitals, the university hospital, the army hospital, the GPs, the army police, community leaders, and the community involved from the beginning. Now it's as if I know best, we just follow what I do. People don't like that. Fourthly, ramping up testing. Now, in a setting of emergency, when people apply for testing kits, they still go through the normal process. The modus operandi is the same. They wait weeks and weeks before approvals can be given. So there is a bit of backlog of cases that have to be tested. So I think in an emergency situation, you must fast track all testing kits so that the saliva kits, the home-based kits can be employed by everyone. Now it is an arduous exercise to get approvals. The fifth thing is risk mapping. What do I mean by that? Risk mapping with epidemiological and socioeconomic factors as input so that you can identify the high-risk areas, not a total blanket lockdown, but focus on targeted areas. Six, a robust testing strategy. According to containment and mitigation phases, you see our contact tracing and isolation of cases have gone down the drain. Too late. And according to what I have on my hand here, the daily positivity rate for COVID is about 5 to 8% of the population. And those who get tested, 5 to 8% are positive, which means if you extrapolate that, daily in the community, we have about 1.5 to 2.5 million cases. But what we are detecting is 5,000 and 10,000 cases, which is only 1% of the active cases in the community. So this is not right. 7, the costs. Now, the cost of the tests must either be given free or be affordable. Now, let me talk about the PCR test. Now, PCR test is a gold standard for acute cases, but it is expensive. To the common man, it is expensive. So I was told a few stories by some of my specialists of a pakcik and makcik, you know, go for rapid test, they're positive, and of course they're asked to go for PCR test. They won't. They cannot afford the test. What do? Quietly they go to the kampong, knowing that they were going to infect the whole kampong. But they have no choice. They don't have the money to go for PCR testing. So this is an issue that has to be discussed. Then the vaccination. Now, so far the vaccination is okay, but these mega centers can be clusters, COVID clusters. I mean, there are a few that have been very well run. I grant that. But many more have not been well managed. And I have received a lot of video clippings about mayhem at these vaccination centers. And it can create a COVID cluster. I just wonder why the Ministry of Health is not involved in this. Because when I spoke to the DG one time, he said, oh, he's not involved. So vaccination must be made simple, easy, taken to the community, walk-in should be allowed. And like what Tan Sri Rafida said at one of your Facebook, go to the factories. I mean, don't discriminate against anyone. Factory workers, those in the manufacturing sector, refugees, immigrants, whatever, you know, you must make sure that you vaccinate everyone. Otherwise, you're not going to achieve whatever you want to achieve. Now, the other thing is, there are people, of course, who are anti-vaxxer, but leave this to the community leaders, get them involved. Let the community leaders, the imams and all that will try to convert these people if they can. Now, blanket lockdown, as I mentioned earlier, is a no-no. Go for targeted approach. And the COVID data must be analyzed professionally, and the information from the data analysis should be shared with the people so that they understand. Now they don't understand. They're being told what to do. They're given statistics. I see they understand. They don't understand. So to them, it's just statistics and more statistics. But they must be told why and how and what will happen so that you can improve their engagement. Now they are not bothered. You know? And then, so to me, the whole strategy is basically you must listen to the grouses of the people on the ground. You must get the local experts involved. You must rope in the private sector, the GPs, the army, the education ministry and all that, and speak in one voice. Now, from what I gather, I'm sorry to say this, but nobody likes detractors. Those who say something different are labeled as detractors and not loyal. So this is the sad thing, you know. You have to be able to accept criticism. Now, if I were the DG of Health, before I appear on TV, I talked about single spokesman just now. Now, the single spokesman must be a responsible spokesman. Of course, it has to be the DG of Health. But you cannot think that Minister of Health knows everything. You must consult the stakeholders, discuss with them, get in their views before you appear on TV. You cannot just appear on TV and say, well, do this, do this, do this. No, you can't. And I've been told a lot of the local experts have been sidelined and have been chastised just because they make alternative opinions. So this is a no-no. So the single spokesman is correct. You must have a single spokesman. You don't have any confusing messages, but that person must only appear after he or she has consulted the stakeholders. Now the NSC makes certain decisions, but do they know the ramifications, the effect it has on the rakyat? Do they know? I don't know whether they know or not. Are they realistic? I wonder. So there are a lot of things to be said, but that is sufficient for the first question.
Dr. Ismail, what is the status of our hospitals now? How are they coping? I mean, as a layman, when I watch the videos and the scene, as I said, they look like a war zone, and we have they don't even have time to clear away the rubbish. And in pictures taken of the hospital in Klang, it's really very sad. What have you heard, and what has the doctors told you about their plight?
Well, they are very, very frustrated. They are trying their best. It is a human resource problem. People are resigning. It's low morale. They are exhausted, and they feel that the top brass are not listening to them, are not supporting them, are not giving them the funding that they need, are not taking care of their welfare and their mental aspects. So there's what they say is true. And unfortunately, all of them have to be anonymous because there's a gag order. You cannot say anything you like. Mm-hmm. So what is very certain is, of course, human resource is a problem. Second is shortage of ICU beds, ventilators, and oxygen. One of my relatives died because of no oxygen. So died. Okay, never mind. But this is the reality. Patients are managed in corridors. Patients sharing equipment. And then the worst thing is, you are trying to have makeshift ICU beds. Well, I support that. You must remember, in ICU care means that the people who runs the ICU must be well trained. You cannot have more and more ICU beds without proper trained staff to manage them. And we don't have that. And then there's this denial by the top brass in the Ministry of Health. And then later they backtrack. They say, oh, yeah, it's true. First denial, that is true. And those who give alternative opinions are labeled as detractors and not loyal to the government. The genuine support from top officials is needed for funding, for support, for looking to the welfare of the staff. And I think the DG should not just stay in Putrajaya. He should walk around, move around, make sure that people feel that they're appreciated, to support them, to encourage them. Now, the other thing you may not know, Dr. Sri, is that tertiary services of the various hospitals have been compromised. What do I mean by tertiary services? For Selayang, for instance. Selayang is supposed to be a designated hospital for hepatobiliary, that means liver cases. But no more. Ampang is supposed to be for leukemias and hematological cancers and all that. No more. All COVID. So what I'm trying to say is people are suffering from non-COVID cases because of the large number of COVID cases. Now, what should we do? Why not rope in the private hospital to handle the non-COVID cases? They are trying to do it, but very staggering,
Yeah.
So people on the ground are very frustrated. They are exhausted. There was one video, one chap trying to push a trolley, one healthcare staff, and he collapsed while pushing the trolley. So they are exhausted.
Yeah.
And the other thing that we can do is empower the people to manage their own health. What do I mean by that? Provide free or affordable rapid antigen kits or the saliva kits, the home-based kits, let them do their own testing. Of course, you must approve the fast, not use the same MO and all that. And then be accessible. So many people have been calling me, hey, what do I do? I found just as late as yesterday, somebody is calling me. I'm positive. I tried Ministry of Health, and nobody is answering. So you have to be accessible to whoever wants to get information.
Yeah.
Once they have the information, because they want clarification, then they will know what to do. Our health information on what to do is to prevent and address symptoms and whether the patient should go to hospital or not go to hospital, stay at home or go to a hotel, quarantine at home, what to do. This is not available, not accessible. So people are complaining about that. And then the last thing is enhancing the healthcare system is imperative. This can be done by employing jobs, contract workers, giving sufficient masks. Don't discriminate between cleaners and caterers and all that. As long as they're in a hospital, they should be treated as a frontliner.
Yeah.
And Ravida was talking about manufacturing sector, Taji Ravida, manufacturing sector, factory outlets and all that. These are people who are also important because they are providing businesses to sustain. So I think
Sri,
yeah.
Are you in any way incorporated into any of the task force or
No.
Of COVID-19 management?
No, I'm not. I don't know why, but I'm not. Because I'm not. Basically, no.
And you think there are many others like you who have the expertise and the knowledge to have not been incorporated into or been basically marginalized?
I'm not sure, but you remember I handled the SARS in 2003. Yeah. The SARS epidemic was handled by me in 2003 for 3 months. Yeah. And so I've got quite a good experience in handling a crisis. Of course, SARS is not a pandemic, but still it spread to many countries and we managed to handle it fairly well because there's only one spokesman. And at that time, the Prime Minister of the day mentioned that the minister should only stick to policies, but technical matters should be spoken by the DG of Health. But at that time, I was just Deputy DG, so I was not DG of Health at that time. But so far, no. Nobody has given me any invitation to join anything.
That's right. This is a different ball game altogether. We are talking about a pandemic that has affected almost like many millions of people in the world, and of course in Malaysia. And in Malaysia, if we are not careful, we are going to breach that 1 million infection numbers soon. Which means that every 32 people in Malaysia, one is infected basically kalau kita tengok secara kasar lah. But my point is here, is the fact that we have been doing this for the last 1.5 years. What else can they do? Perhaps they are, not to say clueless, but they are rudderless. They find themselves in a situation whereby they have never faced such a challenge before. Don't you think so?
I think the problem is basically they don't want to admit the weaknesses and the failure of the system. They didn't ask for help from anybody. This is the problem. When you have a situation like this, you need the whole country to come together, the whole community to come together, fight as a united front. Now it's as if you do as I tell you, and that's it, and don't do as I do. I mean, double standards, you know about that story. But to me, this is a time of crisis. Everybody should get involved. Like my earlier slide, I earlier mentioned this earlier point about collaboration, about coordination is very important. But have you ever heard any minister or anybody asking for help? No, nobody is asking for help. Oh yeah, the army was asked to manage recently, but it was too late and too little. So to me, the whole nation must come together and provide input. That is why I come in. But I've been keeping very quiet. But I thought I have to come in now because otherwise you were talking about millions of cases. But I was mentioning to Datuk Sri Wong just now. Yeah. If you look at the testing strategy, 5 to 8% are positive. And you translate it to population base, it's about 1.5 to 2 million cases a day already. And these people are spreading like wildfire in the community. What are we doing about that? We don't detect them. Why we don't detect them? The kids are either non-accessible or too expensive or whatever, So people are spreading the community. So how are you going to control the pandemic? And then we have people talking about prayers in the mosque and surah. I mean, I'm not saying that I'm that religious, but enough prayers and all that, and the Raya gathering, the Ramadan badars, and all these clueless. To me, it's irresponsible. And what lockdown are we talking about? That day, my brother-in-law passed away. And I told my wife, we cannot go because tomorrow lockdown. She said, no, we must go. So when I went there, I saw what lockdown? Every car, there's a lot of cars on the road already. So people are not serious about it. People are not serious because they just don't understand why this is happening. So risk communication is very important. Somebody must tell them, not necessarily the DG of health, but community leaders, those on the ground, spread the word. Very important for us to take care of ourselves, adhere to the strict SOPs. Now it's a joke. People wear masks because, oh, the policeman is there. They wear the mask. Not because they want to protect themselves, no, or protect others, but because the policeman is there. They just don't understand. That's why I said, when you give data on TV, you must understand why. What is the problem? Why does it happen this way? What are the factors that led to the transmission? So that the common man will understand. And once they understand, then there will be no trust deficit. They will abide by the decisions made. Now they're not, because they look at the ministers going here, going there, eating durian. I mean, there are too many double standards. So nobody is very serious. I'm sorry to say this, but when people go on TV, ministers, they were smiling and, glittering away. And this is not the way to do it. You cannot give an impression that everything is hunky-dory. You cannot. This is a crisis situation. The whole country must be involved. People must be serious. People shouldn't make jokes about anything. Just get the job done as a group. That is what I always say. And
Dr.
remember,
Ismail,
stakeholder collaboration is very important. And whatever decisions you make must make sure that it is accessible to the community as well. And we shouldn't be too punitive in our measures. We are being very punitive now. Sorry, you're saying something.
sorry, Dr. Ismail, you know that we have tried all types of lockdown, real one and not so real one, which the public do not really care. Yeah. And we know that the more lockdowns we have, the more that the public will go against it. They will just give it up. Studies have shown that the more lockdowns have not worked. Now, after 1.5 years, you have mentioned that perhaps we should look at localities. So it will not disrupt the economy.
Yes.
People's rice bowl will not be affected.
Yes.
Now, I think that it's more logical because it happened just a few months ago. There was really nothing in Perlis. Okay, then we locked down Perlis when the problems are mostly in Selangor and in Klang Valley. Now, then we talk about a threshold of 4,000. I mean, 4,000 is not something that we should be celebrating. Really, they're starting to celebrate with 4,000. It's quite frightening. Okay, now, if we continue doing the mass testing, which we have to, the numbers will keep on going up. So the numbers will keep on going, especially in Klang Valley. So we cannot have a continuous lockdown. You mentioned localities. How would we do that?
I was mentioning just now, that's Sri, risk mapping. Risk mapping is very important. Map the risk areas and target those areas. No blanket lockdown because you kill businesses and people get very angry and people will flout the law because they're desperate. So you do a targeted approach. Now, there are two things that we can do. One is, of course, the testing, contact tracing, isolation, and all that. That's fine. But vaccination is also very important because it can take care of a lot of our problems. But so far, I just read last Monday, only 1/3 of the population has been given the first dose. So we don't know when we're going to get the second dose and all that. So vaccination is also very important, but make it simple and easy for people to get vaccinated. So one is mass testing, contact tracing, isolation. The other one is vaccination. That's very important. And of course, each of us has got to play our part in adhering to the SOPs very strictly. Don't leave home if you don't have to. Always wear a mask. Be responsible. Don't wear a mask because the policeman is there. No, you must know the reason why you're wearing the mask. Protect yourself. So long as there's no this communication, nobody is talking to them, to the masses about this, it's not going to work. I can tell you that. And of course, I agree with you totally. This blanket lockdown is a waste of time. Imagine from 4,000 now we got 11,000 cases a day. Of course, you can say mass testing and all that, but what are we trying to do? You don't want to shut businesses for nothing, So do a targeted approach so that people will understand that if you do better, you'll be out of the loop. So people will be responsible jointly, saying, okay, I'll do better so that I will be in that group where I'll have a total lockdown. So those are the things that are important to me, Sri.
Sri, Do you think the health system is good enough to manage the crisis now, or you believe there is a need to revamp the system, or is the system to be blamed?
No, I don't think the system needs to be blamed because this is a public health issue. And the public health people have done whatever they can do. And the hospitals are doing the best they can. But as I said, you must involve the whole health sector. Why are we so diffident in trying to get the private sector on board in the beginning? Why are we so diffident to get GPs involved in the category 1 and category 2 cases and the vaccination in the initial stage? Why? Why are we so, so dependent on Minister of Health to do the thing? You should rope in the health sector from the beginning. So when you say revamping, we are not actually talking about revamping. We're talking about making things better by roping in the whole health sector. GPs.
The system is already there.
System is there. The public health needs to be revamped, yes, but the public health system already is there. They're doing whatever they can. And even the people on the ground, they're doing whatever they can. But they must get the support that they need. Nowadays you see, billion announced by a package, billion here, billion there. But is that the answer? That is, to me, ad hoc. What is more important is to make sure that you look into the grouses of the frontliners in the hospital. Because now, one fellow was telling me, focus on hospitals. Focus on the care of patients who go to the hospital. So this is one area that needs to be looked at because it's crippling. And I've got calls from Sabah, Sarawak, everywhere. They're so frustrated. They're doing so much, but they cannot cope anymore. So let the private sector come in, and let the GPs come in. The category 1 and category 2 patients should be managed by GPs, But there's no quick fix on it. And then there's another thing. One minister called me and said that somebody up there likes to quote WHO. WHO says this, WHO says that. But WHO always mentioned that you must be specific to that country. You've got to cut the coat according to the cloth. Each country has got a different strategy. So don't talk about WHO this, WHO that, You must be guided by WHO, but not be enslaved by what is recommended by WHO. That is my view.
Yeah. What can we learn from other countries, Tan Sri? Say from US or England, in managing. They have their own major problem before.
Yeah. Most countries are telling themselves that they have to live with COVID. All right. So life goes on as usual, and each of them do their own thing, but they adhere to strict SOPs. So, and vaccination is the one issue, one area that they always focus on. So, but we are so ramped up with statistics and figures every day. They're not so focused on figures and daily statistics like in UK, for instance. They're not too bothered about it because they say we'll have to live with the COVID. And how do you live with the COVID? You must protect yourself at all times. Even if you have vaccinated twice, and you think you're fully protected, you still cannot let go of the fact that you have to make sure that you adhere to SOPs. Now the variants that are coming in, now we know that various vaccines have got different strength in trying to protect against the variants. And we know the variant, especially the Delta variant, is more serious, more contagious, and can cause symptomatic disease in a much more aggressive way. So the way to tackle this is to get vaccinated. Doesn't mean that you can protect against the variation, but at least the symptoms that you get will not be as severe as you would get if you had not been vaccinated. So that is my take on it.
Doctor, I want to talk about Selangor because this is the most industrialized state in Malaysia and obviously the most important state in Malaysia, and it has got the highest number. Now, the Menteri Besar has said that 70% of the cases are from factories. Another minister says no. Then another health official says, oh yes, it is in the factories. So we can conclude that the minister is not correct and that the cases are mostly in the factories and in manufacturing sector. Okay. So does it make sense as a layman since we know that these are the locations and the factory areas, for example, in Negeri Sembilan, obviously Manting area because the factories are there, and we know in Johor, okay, these are the factories. These are the areas with a lot of factories. Does it make sense if we were just to send people to these factories to have them vaccinated? We know that this is a problem. Does it make sense?
It doesn't make sense. You should get the vaccines to them.
Yes, okay.
Get the vaccines to the factories, to the mainstream sectors. Make it easy for people to get the vaccine. Sending them on a bus to go to a vaccine site, a mega site, is ridiculous.
Okay.
As I said, even the mega site can cause a COVID cluster. So factories, these people, they should have a different strategy for the vaccination. Although that is a solution, but you must make it easy for people to get vaccinated. So your point is taken.
Mm-hmm.
And there should be any denial by anybody. A lot of people are denying. Why? Why do you deny? Politics? You want to feel good about it? People know the problem is on the ground. Don't deny anymore. And don't come and announce packages and smile and all that. I don't like that. I think that is sugarcoating the pill.
The reason why that the private hospitals and the GPs it has been said that they're not involved because that they're just not enough supplies of vaccine. Do you share that view?
Yeah, because I don't think so. Because the vaccines, as far as I'm concerned, you can use a different channel for the vaccines. Vaccines are available everywhere. Mm-hmm. So the private sector is prepared to use some other vaccines, like the Sputnik vaccine, for instance. But then to get approval of a Sputnik vaccine from NRA is a nightmare. So that's not being done. Mm-hmm. So that excuse of not getting the vaccines to the private hospital is not correct. As far as I'm concerned, the government has got their own chain. The private sector should have their own chain. And as long as vaccines are available for people to buy, get the vaccines. Get the people, to go and get. I got patients coming to see me. I haven't been vaccinated. I mean, I feel sorry for them. At this stage of the game, you're still not vaccinated. Why? Well, I've already checked with my Sejahtera and all that. So to me, everybody has to be in. Irrespective of who you are, you must be in. Otherwise, it's a problem. Now there is a trust deficit between three big players. This is something which I have to say at the conclusion. Now, Ministry of Health should be the command center. Right? So that's correct. But you must not just be Ministry of Health. It should represent the whole health sector. I think I've said enough on this. Don't think that Minister of Health knows everything. You must bring in the whole health sector. So have one spokesman for technical matters. And be responsible when you say things like, so that people don't make it a joke. And once they think you're a joker, they will not listen to you. That's number one. Number two, the National Security Council, that is the other arm. They also make decisions. Okay, they're supposed to make policy decisions, we agree. But with input from Ministry of Health. And there should be no fighting among themselves. First say this, that first say this, first say this, like you mentioned just now, factories. It's ridiculous. You see, when I was handling the SARS crisis, people will try to see whether you are bluffing, whether you're telling lies, whether the facts are misconstrued, whether the facts are made up, or whether the facts are doctored. And you must not give that impression to them. Because the moment they test that, or they realize that you are telling them lies, or telling them half-truth, they will not listen to you anymore. That was my challenge during the 3 months when I was handling SARS. Because I remember one Singapore asking me, how come Singapore 100 cases, you only got 1 case? I expected that already. So I anticipate the question. So I told the mass media from Singapore, I said, you haven't handled a crisis before. You haven't handled a pandemic before, an epidemic before. That is why you have 100 cases. You have got our experience with the Nipah virus and the H1N1. So we are doing better. So that kept him quiet. So you must not allow this. And politicians are talking all sorts of things. You shouldn't speak with one language, and there must be no trust deficit. And the third factor for Ministry of Health, NSC, with the government, the third factor is the community. We have to play our part. But are we? And why are we not playing our part? Is it because we don't trust the government? Is it because that we are so desperate to find jobs? Is it because we feel that the lockdowns are too stringent? There are many, many questions that we need to ask. So to me, risk communication, telling them what is the problem, how to settle the problem, short term, long term, middle term, that would be something that we need to look at.
Dr. Ismail, do you think that many of our politicians, they are making populist decisions because and it has affected our planning? Like we all know that you mentioned that the Ramadan Bazaar, everybody say that, look, it's going to be a cluster. And sure enough, it was a cluster, okay? But, you know, that FD says okay, then Selangor was halfway. And then that during December last year, it was like free for all. Everybody was allowed to travel, Christmas party in the streets of Penang. And now we may have, and then this says no traveling, no interstate. But I read somewhere that some institution of learning was allowed to organize a balik kampung for the students. So we can see that there was no a proper adherence to SOP. Now Hari Raya Haji is coming again. Perhaps that they were much more stringent now. And you mentioned about these politicians breaking their own rules that they made themselves, and they have not been fine examples. At what point do you think that how much power does the DG of Health has? I mean, you were a former DG, and at what point you can say no to a minister, for example?
Well, when I was the former DG of Health, I mean, I was then a deputy DG. I was not even a DG actually. I was just a deputy DG. But whatever I said goes, because the Prime Minister supports what I say. The Prime Minister supports me. So now, if the DG of Health is like a toothless tiger and nobody listening to him, he can bang table all he like. But if you are not being listened to, then that means that you have not lived up to your expectations. That's what I'm trying to say. If I were the DG of Health at that time, I would have said, no, no, no. What is this Raya celebration? Going and kissing the old man, and then I wrote in the papers, you know. That's all this. No need for all this. We have to be very strict with our SOPs for everyone. No Ramadan, no Raya gatherings, no visitors, no interstate travel, no social gathering, no dining in, nothing for a period of time. It's not permanent, for a period of time. But you have to adhere it very strictly. Not like now. Now it's a joke. And then we hear that somebody in, I wouldn't say who, but somebody in Johor said, Friday prayers allowed. Why the need for all this? Don't do this. As I was telling you earlier, the transmission, the positivity rate is 5 to 8%. At least 1.5 to 2 million people floating around is COVID positive, but who has not been found out because they're asymptomatic. So do we want these people to trigger another cluster? So you have to be strict. As far as I'm concerned, if I'm the DG of Health, I will say it, and I'll say, look, no way you can do this. And I'll give my reasons, of course. I won't just bulldoze it, I will give my reasons. And I will listen to their views. But this is my decision. But the Prime Minister must support me.
Yeah.
Actually, see, of course, the DG has his boss. You have the TKSU above you. You have your KSU, and of course, the minister. Now, the other thing is about decision has to make based on science, basically, in matters like this. And decision has to be made based on health issues, health matters. Yes. Basically, it should be a health decision. But there is always a political decision that will come in. And how do you try to manage between the two, Tan Sri? I mean, based on your experience.
Based on my experience, I told all politicians to shut up, literally. The only person who can speak is the Minister of Health on policy decisions. But our Minister of Health at that time did not interfere with any of the decisions that I make. Of course, I keep him informed, but he will make policy decisions. Technical matters is me. In fact, I was on TV, on TV3, telling a few politicians off for questioning my numbers. So that is the thing. You cannot question on technical matter because the DG of Health knows best. Not even the KSU, not even the TKSU, not even the minister. Right? So the DG of Health, but of course, you must be polite. Sure. You cannot be, saying that you're the big hero. You must be polite. Mesti adat tertib. You must tell the Minister of Health, sir, this is how it's going to be, blah, blah, blah. Be polite, be humble. Don't be, someone that, people hate.
Yeah.
And then if people hate you, people will not listen to you. But you must be pleasant enough to say something in a way that can be accepted by everyone. That is the message I want to say.
Okay.
Very diplomacy is important, but you say it as it is.
Are you implying the current one is not
implying anything?
Subtle enough.
I'm not saying anything, but I think you all know what I'm talking about.
Okay, Tan Sri Ismail, I want to move a bit away from COVID-19 before we conclude this program, because this is related. You know that many of the contract doctors are complaining. We have come to a situation where we all know it would happen, because in Malaysia, we have produced too many doctors. There are 32 medical schools in Malaysia. Out of the 32, 11 are in public, 21 are in private. Everybody wants to be a doctor. We have produced too many doctors, not enough specialists. So the result is that hospitals cannot absorb them. We have more medical schools than in Australia. That is a fact. And a doctor-patient ratio of 1 to 1,004. So now we have this issue of junior doctors who are really, really unhappy. We know that this shouldn't happen, but can you share your view on this?
Okay. My view is very simple. Well, too many medical institutions, I agree. But then we should stop all that. No more medical schools. Okay, what has happened has happened. That's number one. Number two, you've got doctors who have graduated. You cannot just tell them you got no job. You have to employ them. And when you talk about the ratio, population ratio, doctor to population ratio, different states have got different figures. If you look at KL, it's 1 to 300. Because Sabah, Sarawak is 1 to 2,000, 3,000. So these people can spread everywhere in the country. I don't just focus on the big urban areas. So since the medical school, you cannot do anything about right now, put a stop to it. Those who have graduated, you must give them jobs. You cannot just let them, just stray away. Give them jobs. I'm sure there are a lot of things they can do. Because right now with the COVID, you need professional people to handle the pandemic. So contract officer now, I heard the Prime Minister wants to bring it to cabinet and all that. After so many months, look, the contract doctors have a problem. Okay, now I've been saying this to my group. In order for Ministry of Health to fight the JPA, not fight, to convince the JPA, you have to be united. So the Ministry of Health has to be united, meaning the KSU, the TKSU, the DG, and the Minister must all speak with one voice. So they must understand the issues. Why is this a problem and what we can do for them? We cannot just rush off the issues, which is what's happening now. So once you go with a united front to the JPA, I don't think the JPA is going to say no. They will have to find ways and means of trying to employ these people. You have to employ them. If you don't employ them, it's going to be very unpopular. And these are doctors, Basically, they've been trained to be doctors. So what can we do about that? Sorry,
I have two last questions for you. The first one. You see, if you were to watch, social media, you go through social media or some of the newspapers, the last 2 days was really hell at the CAC Center at Bukit Stadium Malawati. You see, 4,000 people. These are all affected. These are all positive people. And you can imagine, can't they open up more CACs? This is the processing center. But someone I know was there from 8 and he got the attention only at 5 in the evening. You can see that.
Correct.
What is your comment?
I agree with you. My comment is, you're talking about vaccination, right?
Yeah, no. This is actually the processing center.
Processing center.
Yeah,
okay, the processing center, and these people.
And they're all positive.
I have many stories of people going to Malawati Stadium, being positive and being seen only. They go at 9 a.m., they be seen only at 5 a.m. What's the problem? Get the GPs involved. The local GPs can take care of these people, but they must be briefed first. Brief them, and then so that these people don't have to travel. I know of one person who traveled to Malawati, he stopped by and take nasi lemak. And in fact, a few others. So why not get the local GPs in nearby areas to be involved? Of course, they have to be trained. They have to be trained what to do and what not to do. And finally, they go there, then positive. And then they spread the positivity everywhere. To me, that is something that has to be addressed. I don't agree with it because you make people's life difficult going there. And then finally, there's one person who went there, got positive, got admitted to hospital, and we had to intervene before he got the oxygen and the treatment. So it is not the right thing to do. I don't think it's the right thing to do. There must be another way of looking at it. This is where I said the GP should come in with the category 1 and category 2 patients. What is your next question, Tan Sri? You say you got 2 questions?
Yeah, my last question will be after Datuk Sri Wong.
No, I mean, I'm ready for your second question. That's a follow-up.
Okay. Tan Sri, what compel you to come out in the open today? I mean, tonight.
Yeah.
What you have mentioned earlier, the reason why you wanted to speak up. But, for someone like you, of your stature, who has been in the business for a long time, you should be enjoying your pension, your time with your family and everything. And now you're speaking up. Is there any particular reason for that?
Well, the reason is obvious because the health system has crumbled very badly. And I've got calls from so many people, specialists, doctors, former pengaras, to do something. Because they know how I work. They were in the era of the SARS, but they know how I worked. So they know I call a spade. And I don't book any nonsense. And at the same time, I practice diplomacy by not being too aggressive when I meet people. So they have been asking me to help out, to speak up. So when Datuk Sri RealChunWai called me, I said, no lah, Astra Wani wants to talk to me, Britannia wants to talk to me. I said, no. But then cases are mounting. It'd be irresponsible for me not to speak up as a former DG of Health and as a person who have handled the SARS crisis before. And they are asking me to speak up. And today's Zoom meeting, so many people are cashing in, saying that they want to listen to what you say. I'm sure you say as it is. You are the only one who can say it. That sort of thing. So this is the reason why, That's Sri. It's my duty, my responsibility.
They're looking at you as a surveyor.
Okay. Tan Sri, before we wrap this up, I want to just ask you a point. You have mentioned at the beginning of this program that you say that the train has left the station. Okay. So it has left. But we need, as Malaysians, we have no choice but to run after the train, the runaway train. Okay. What is our last parting message to those of us in Malaysia who are really desperate, but we have no choice? We have got to chase after the runaway train.
Okay, so I think each one of us has to do our own part. We cannot simply depend entirely on the government to help us. So we have to be in this together. So as a common rakyat, we have to do our part, practice SOPs, do the masking, the social distancing and all the rest of it. So that's very important. Community means not just us, but also community leaders, people, the imams and all that, play their part in trying to get people to come forward, to understand the problem, and to understand the need for the vaccination. Now, the Ministry of Health, of course, you cannot just say, oh, sorry, so many cases I cannot handle. You have to find out how you can manage the situation. It is bad, we know, but surely there is a solution. And I can tell you of a solution very easily, but you must be in the picture so that you can listen to all the viewpoints and you provide a solution. Okay, and then the Ministry of Health has to call the shots, but in a nice way. And then the NSC, okay, they are playing their part, but to me, they are more populist decisions. Doing this, doing that, but they shouldn't get the go-ahead unless the DG has cleared it. And of course, the PM must support the DG. Fourthly, the vaccination thing must be brought to the people. Go to the factories, go to the community, make it easy for people to get vaccinated, get the GPs involved, get the private hospital, get vaccinated as soon as possible. Because once you get vaccinated, even if you get the variant, your symptoms will be much less serious than if you don't get vaccinated. And the last thing, of course, the tracing, the rapid kits and all that must be accessible, must be affordable, and approvals must be done very fast. Don't follow the modus operandi. So we are all in this together. So, okay, the train has left the station without a driver, somebody said. So now we have to put a driver in so that the train can move in a nice way. Put a driver, somebody who can drive the train. And who that somebody is, I leave that to you.
Thank you, Sri. Dr. Ismail.
Yes.
I'm sure that we will be on track again.
Hopefully.
And thanks to Johan for joining us. And that to all Malaysians who are watching this from around the world, please stay safe, support what we are doing, support the frontliners, and do support all constructive ideas and opinions. Do respect constructive ideas. Let us be frank, because we're in this together as Malaysians and as one country. Good night, everybody. Thank you.
Good night.
Bye-bye.